Welcome, ladies and gentlemen, to the first of its kind YouTube channel for South African Emergency Medical Services. Channel's name is, as you can see, SA EMS Insights. What I want to bring to your attention is we're just going to discuss some topics, interesting things for us to be able to comment on and just share some knowledge. So first things first, we will take a look at a new thing from HPCSA. Some of you are familiar with it, maybe some of you are not. The listing of capabilities and medications came out April 2022. It was a big shock to me as well. We will take a look here. Very important, just a disclaimer for everyone. This is not a CPG update, nothing like that. We are just discussing, sharing with you information so that we can build a good, healthy community on South African resources for EMS. So we'll take a look at the context. Here we will see list of capabilities and indications. Just a screenshot from it's the same layout as the 2018 guidelines. However, there was now the update just on the medication section. Please note, if you haven't done an update or any skills or any CPG updates, you should not be doing the skills. And also, this is not, once again, any formal training. This is just a discussion. And then please take note, there will be mandatory senior emergency practitioner and or supervising medical officer consultation required. You'll see that later on. And then the most important here, we'll see that you must take a look. You'll see them at the end of the protocols or guidelines. Includes, you'll see, I'm not going to read through all of them. Just want you to take note. Actually, we just go back on that one to never mind. Let's take a look here. You will see capabilities airway. It looks very much the same, obviously. However, things that have been added, let me see here. I have my documentation in front of me to be able to discuss this. On the airway management side, not much has been changed. I do recommend going through each topic with your scope of practice, your relevant scope of practice, and correlating, making sure that there is no new updates. And please take a look here on the sides. You'll see there's now specifications. We'll see it more with the drugs. But yeah, let's go to the next slide. Then we'll see here everything's still very much the same. I believe these came in with the 2018. Yeah, these are still the same. And then we'll see here is a new thing. I have the 2018 in paper in front of me. We'll take a look. Use of capnography, capnometer via endotracheal tube extraglottic device for the ECTs. There is now a training session that you guys can attend. And also, if I'm not mistaken here, for non-invasive ventilation with mechanical ventilator for the ANTs, please take, oh sorry, it's a mechanical ventilation unit. Yeah, that has been added. Please take a look there and get familiar with that. So just to see here, we have the peripheral intravenous cannulation as per relevant protocol, limbs, hands for under 1 year old. Okay, now I read the wrong one, sorry. Peripheral intravenous cannulation as per relevant scope practice, infant scalp. We have this that has been added, whereas the 2018 that wasn't there. Sorry for that mistake there. In any case, let's carry on. Don't want to make this video too long, but we want to run through this, talk through this, and would like to hear your comments on if there is any comments. Let's see here. Oral rehydration still there. Nothing else on the 2018. If I missed something, please let me know. I do not mind. Okay, circulatory management. There's still, everything looks more or less the same, but as we can see here, there will be on the side informations, they're still the same. Okay, let's carry on. Yeah, these ones. So currently, we all need training on those, but I'm sure everybody has sufficient training, especially postpartum image training, and then the good training on the shoulder dystocia and recognizing what to do. So that's just the surface of it. In any case, we take a look here further on. We see that we have everything still looks the same here. And then we go on to, so this is obstetric management. There's nothing added new though, nothing removed, as I can see quickly. Use of ultrasound, everything looks the same. There's nothing being added or removed. We go to general. Yeah, everything is more or less the same, but we will see that there is the manual. That's still good. Everything looks good. We will have these little numbers that you can reference to the end of the slide that I showed in the beginning, or at the end as well. And then withholding resuscitation. Once again, just to have clear, good training and communication on that. Anything else that I see that is, I don't see it. If I do, I'll just mention it in the comments. Let's see here, next one. Take a look, list of medications. So here is where it gets interesting. The first thing that we'll see here is how we should give it, which I personally think is a great way, just to clarify, and then also share with your employers or staff members, have a little training, discuss these things, how to give them. We have all these different options of saying how to administer, especially with the AAs that 2018 got the go-ahead for the adrenaline, intramuscular, intravenous. We'll see there. Then we have a separate column which does not is not as clear in the 2018 guidelines. However, in the 2022 guidelines of medication guidelines, it's more clear. And once again, we have the little star at the top, which is still the same. New thing that came out was these yellow bands, which was telling us, sorry, I've skipped a few. We have intravenous, which tells you exactly how to give it for that specific drug, intravenous and intramuscular. Let's take a look here. What else has been updated? Atropine, we'll see here, which is IV, and then we have atropine use in toxidrome, which is you can give it IV or IM. We'd like some more discussions on that. Anybody that has had some organophosphate poisoning cases, you can in the comment section just give us more information about it, what dosage worked best according to versus guidelines and the SAMF. So yeah, balanced salt solution. We'll see here for AA, ECT, ECA, ANS, and ECP, not to be prescribed, supplied unless through direct medical practitioner prescription supply. All other professionals, registration category is not permitted, currently undergoing review. So just to give some clarification, I'm not from HPCSA, just finding these documents and we can have a discussion. If someone can give more clarity on this, what this exactly means, what is being reviewed, and is it then to use, not to use, but in any case, just to take note of that. Then for the ECPs, we see here something which is the yeah, there we go. I'm not the betamethasone. Sorry, yeah, my pronunciation. In any case, we'll see here. What's that? It's still the same, but we don't have. I don't see it yet. Yeah, it's still the same. Sorry. So this is, sorry, my mistake. It's still the same. Everything's looking good here. However, it just gives you the way of administering it intravenously. Calcium chloride, gluconate, got that all in there. tells you intravenously. We have clopidogrel oral, we have silazine, which is intravenously, which also states here, but doesn't exactly state it. Yeah, that's new. I don't see it on the 2018 guidelines. Okay, let's not waste more time. We have nothing else. So yeah, take your time, go through these slides, pause, make sure that you see something new. The links will be at the end of the video to take a look. We have the Indextran intravenously, so I'll take a look at the dosages, how to give it, get familiar with it. Even though we have our voluvins and our voluvins, the starches, all those things. Speak under correction, but Dextran is available for use and intravenously, just specifying it more clearly. Dextrose, so here's another thing that came out for the scope of practice. On the 2018, they mention dextrose intravenously, only adult for 2018. However, it's been updated so that these following applicable scope of practice categories can give to adult and pediatric. Please take note of that, but not neonate. So neonate has been set apart. And then just guys, please make sure of the dilutions, which is really important for these kiddies, and then fluid administration as well, according to scope of practice. So let's carry on. So you'll see here the guidelines stop at Dex, but it carries on in the 2018 guidelines. Then we carry on to dopamine. So dopamine, as you can see, I'll leave for you guys, ECP, ladies and gents. You guys can sort that out for you. Then we have diazepam, which is now all routes. So it can come from anywhere. But yeah, another thing is leave some comments on how the uptake of diazepam has been on patients, what you have mentioned or what you have seen. IM, IV, intranasally, and the types of patients, skinny patients, more obese patients, kids, adults. Let us know of how it has been reacting on the type of or the route of administration and the dosage as well. So let us know what works. Just give us some information. We can discuss that as well. Then let's take a look here. This one here, that's also, I don't see that. Okay, that's also out. 2018 says it's a blue block here, but not to be prescribed or supplied. Enoxaparin subcut, where it doesn't state in the 2018s if whether it's subcut or the route of administration. So we carry on here. It's quite self-explanatory. Inhaled, intravenous, phenytoral. Got all these drugs that are available, but then you can take a look at how they are being administered. Yeah, so I'm not going to spend too much time on this. You can take a look to the next video. After the next one, we'll see here ketamine. So we jump straight to ketamine. However, on the 2018 guidelines, we missed a few, but in any case, I'm sure they will put them in here. But just take a look, compare. Make sure, guys, here's a tip, just print out the guidelines, 2018 guidelines. Print them out, make a little booklet, and then you can go through it, ask questions, and read through them continuously. And there's a reference list at the back as well. Okay, so let's see here. Ketamine, we have, which is still being, it's the same in the 2018. These are all, this will be IV now that you can see. Loraz, intramuscular, intravenous. Okay, sorry, I missed here. Intravenous arrhythmias, IO flush. Oh, another thing is, please let us know on who uses the IO flush. Do you see any difference in the patient if they are conscious enough to even feel pain? Just let us know what's your views on it, and Yeah, we see a lignocaine, intravenous arrhythmias, which is the same in 2018. Lorazepam is mentioned here, IMIV. However, we'd like to know, let us know, what do you guys start off with? What aliquots do you start off with your lorazepam for seizures? Let's keep it to seizures. Yeah, seizures is ECAs and AAs, and then you guys can have a feast with your sedation. I'm not sure, in any case, but let's carry on. Magsulf, magnesium sulfate, we can see here there's a nice, okay, it is the same 2018. So just let you know, now I have the 2018 printed out in front of me. Then we carry on to methylprednisolone, intravenous or intramuscularly. Okay, so it doesn't state here, it doesn't state on the 2018 whether the route, just speaking on a correction, I don't think it's even there, but in any case, see here, okay, so familiarize yourself with this, look at these ones, all routes where Medaz has no specific one on 2018, and then we've got Pentrox there, all these drugs here as well. Let's carry on, let's see. This one is, what does it say here? It's, yeah, it just says on the 2018 oral IV. But you guys, ECPs, you can talk about it with one another. Just make a chat in the group, on the comments. Nitrous oxide, we'll see here. Everybody's still going ahead, even though who still has them on the ambulances. I don't think. In the Western Cape, I don't think many people have it on the ambulance, even though it's a requirement, if I'm not mistaken. On this one, let's see here, it's still, yeah, everything's still good here. Carry on. Where are we now? Oral glucose. Okay, obviously that's still good. Powders, oxytocin. You can see here there's intravenous, intramuscularly. Okay, I'm going to run through this, not to waste too much time, but take a look, get familiar with these ones. Ringers, even Ringers lactate is being specified now, where I believe previously it was not specified. It was just assumed. Here we have all these drugs here for you guys. Then inhaled intravenously, it helps quite a lot. So yeah, even TX Vicuronium, all these things are here. Everything's still looking good. Next, and then we have obviously our wait a minute, I think I missed the thiamine, which says IM, but yeah, take a look at the previous slide, we'll see that. Try to go back, but thiamine is now IM according to the guidelines. And then we have even water for injection, water for inhaled, and cyanide antidotes. I think this is a new one for everyone. In any case, this is the updates. If there's any questions, let me know. Yeah. So this, you can find the link here for the document from HPCSA itself, and then I will update with new videos. And then this is the first one for now, so we'll see how it goes. If you have any questions, comments, suggestions, just let me know. Thank you, and speak soon.